It's every parent's worst nightmare. You're having a nice meal with your baby and all of a sudden they seem to be choking. What are you going to do? Do you call 911? Do you start CPR? I'm going to tell you right now what to do with your baby if your baby's choking and conscious. Now, I do recommend that every single parent and caregiver does a CPR and infant safety course. Even if you've done it before, this is a really excellent refresher. Now, this video is going to assume that your baby is conscious. They might be awake or looking around at you, but scared. If they're coughing or choking, you let them do that. That's the best way to dislodge any food at all. If they lose consciousness, that is not what we're talking about today. That would require CPR and not the focus of this video. Then you're definitely going to call 911 exactly right away. Even if your baby starts choking, if you have someone around you, please call 911. You want to make sure that someone comes to help you ASAP. So your baby's choking and coughing. You let them do that. You encourage them to cough. You might want to lift them up a little bit and even have them a little bit forward so they can dislodge the food. If you happen to look in the mouth and you see the food, please remove it very simply. Do not put your finger down their throat. That could dislodge the food even farther down the esophagus or feeding tube, and that would make it a lot worse. So you're going to encourage them to cough it up. If they're no longer coughing or choking, here's what you do. You hold your baby like this, sandwiched between both of your arms. First, you're going to start with back thrusts. So you turn your baby over, supporting them at their neck and shoulders and chin, and you start with the palm of your hand to do thrusts to their back. 1, 2, 3, 4, 5, always supporting their neck and their face. You then turn your baby over and you do chest thrusts. 2 fingers, middle of their chest between their nipple line. You want to go down deep, at least 1.5 inches, ideally about half of their thickness of their chest. 1, 2, 3, 4, 5. Switch them over. Sandwich between your 2 hands. Again, a back thrust, the heel of your hand. 1, 2, 3, 4, 5. Switch them over. 1, 2, 3, 4, 5. You do this a few times and then you look at your baby's mouth. See if there's anything there. Can you remove anything? In the meantime, someone's calling 911. If you're by yourself, pick up your phone, put on speakerphone, and dial them while talking to them while still doing these maneuvers. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Fast. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Keep doing this until help arrives. Again, if your baby loses consciousness, you want to start CPR, and that is not the point of this video. If your baby's unconscious, you need much more life-saving than what we're showing you here. If your baby vomits it or coughs up the food, give them lots of support, give them cuddles, give them some milk, or breastfeed if you're doing so, and make sure they're feeling well until further help arrives. And now, hopefully you'll feel well equipped in case your baby chokes. Do you want to learn more about what to feed your baby? Click right here and learn all about introducing solids to your kid. Want to learn more about head injuries? Click right here and I'll tell you all about them, how to identify them, and what to do about a head injury. If you have any questions or things you want to learn about with kids' health, leave a comment below and I'll do a video on it. Click subscribe and don't miss any new content.